On Wednesday. We'll get back into our Wednesday rhythm. Also tomorrow at 2:30, Dr. Alexander Scott will be joined by her colleague, Dr. Chan, doing a special Facebook Live event, so I would encourage you to tune into that. And then I'll be joined on my Facebook page by Dr. McDonald on Monday at 10 a.m., and I hope you'll tune into that. So, as I said yesterday, we're in a tough spot right now. We're not where we would want to be, and we have to make some changes so that we have to course correct. You know, yesterday I talked a lot about Wisconsin as one example. If they had made some course corrections a few weeks ago, they wouldn't be opening a field hospital today. So that's what we're trying to do now, raise the alarm, get everybody focused a bit more so we can course correct. And to that end, I want COVID to be top of mind for everybody. I'm asking you to be a little more conscious, a little more aware. Tune in today, tune into the Facebook tomorrow, tune in on Monday. I want you to start asking yourself, what can I do? What can I do to get Rhode Island back on track? And part of that is staying informed, so if you have some time, I'd ask you to tune in to these extra pieces of coverage that we are having over the next few days. So we begin, as we always do, with the data. I'd ask you to please put the dashboard on the screen. Not a great day yesterday. We performed over 12,000 tests. That's good. And unfortunately, we had another 228 cases. So we continue our climb for a percent positive of 1.9%. And sadly, we saw yet another 2 deaths of Rhode Islanders due to COVID. As I said yesterday, so the good news is we're doing a lot of testing, a lot of contact tracing. Someone asked me, is this the spring? This is not the spring. We have a pretty sophisticated system set up so we are better able to pinpoint where the problems are. And the overwhelming problem that we have now, the overwhelming pattern, is small gatherings of family and friends, informal, casual gatherings where we feel comfortable. We're with people we know. And so that feels safe, and we let our guard down. We get within 6 feet. We share food. We take our masks off. Not so much huge gatherings. So now cases are coming. We're seeing the cases coming from intimate indoor gatherings. You invite a few neighbors over to the house for dinner, which means there aren't as many levers that I can pull. You know, it's harder to regulate and enforce our way out of our problem now, because most of the problems we're seeing are happening in your home, in your backyard, in a break room. So I'm going to be counting on each and every Rhode Islander to be more aware and try a little bit harder. Because the changes we have to make are in our personal lives, you know, in our homes, in our cars, in our backyards, in our neighbors' homes, in our neighborhood. And, you know, look, this is really hard. We've been at it a long time. By and large, everybody is following the rules. Everybody is trying. Everybody is sick of doing this. And I hear you. Having said that, we just have to try a little harder, get a little more focused, because we're in a bad spot right now, and we know if we make some adjustments, we'll get back on a better path. And unfortunately, we also know with certainty, if we don't make adjustments, things will get worse, and then I will have no choice, as is happening in other states, but to pull back on our economy, pull back on what we can do. By the way, I don't want to do that, and if we all come together again now, I don't think we'll have to do that. So today I'm going to outline some actions that we can all take to be part of the solution. But I really want you to ask yourself, Rhode Island's in a tough spot right now. What are you going to do to adjust your behavior at home, with your family, with your friends, in order to make progress and help us out of this incline in cases. And I'm going to give you a few suggestions. So let's start with holidays. Halloween's 2 weeks away. Yesterday I asked you to cancel your Halloween parties. If you haven't had a chance to do that yet, now's a great time to do it. I want to talk especially to young kids, high schoolers, college kids, young adults. I know Halloween parties are fun, you look forward to them. You're young and healthy, you want to have a party. This year, no Halloween parties. It will make everything less safe for everyone. So, trick-or-treating, we are going to allow. A couple weeks ago, I said we'll have trick-or-treating. Yesterday we were asked about it. We thought long and hard about it. And we're going to go ahead and allow the kids to trick-or-treat. Trick-or-treating gives young kids a sense of normalcy, an opportunity to be outside. It's a big deal. Having been a mom of little kids, trick-or-treating is a big, important part of their lives, and so we want there to be some trick-or-treating. But I want to say this. To those who are going trick-or-treating, you have to wear your mask, and not a costume mask, a face cloth covering, even when you're outside, while you're trick-or-treating, and please go in small groups. Go really with the people you live with, you know, your family, maybe the kids who you're close to at school, you know, people who you know, who you already spend a lot of time with, and it's a small group. Parents, I need a hand enforcing this, and I know that won't be easy because the kids like to go out in big groups and run all about, but please have them wear their masks, wash their hands, and go in small groups. I'm also asking that you do your trick-or-treating during the daylight. So maybe start a little bit earlier. We'd like trick-or-treating to start and end before it gets dark. As it gets darker, it's harder to control things and harder to stay safe. And frankly, kids, the longer they're out, the harder it is to follow the rules. So let's have fun, let's trick-or-treat, let's do it safely, but let's limit the amount of time that we do it for and try to get in the house before it gets dark out. But if you're a parent, I'd also ask you to consider alternatives to trick-or-treating. You know, maybe buy candy for a movie night, watch movies, maybe watch movies outside, arrange a Zoom where your kids can show off their candy to their friends. Any other creative, safe ways to celebrate Halloween where the kids can get dressed up in their costumes, I would ask you to think about it. Back to the college kids and high school kids and really anyone else. Please don't have a Halloween party. Yesterday, it was said to me, someone said, "Hey, Governor, I'm not canceling my party." So let me just say this to everyone. I'm asking you, please, to forego Halloween parties for 1 year in order to save lives. If you do have your party, you will be part of an increase of cases that is going to lead to more hospitalizations and more deaths. If you have 25 people over, you might not get sick, but others at your party might. They may be young and healthy, they may be asymptomatic, but they might go to work the next day or ride the bus the next day, and then get somebody else sick. And before you know it, our hospitals will be overflowing, I'll be shutting down businesses, our unemployment rate will go back up, people won't be able to go out for dinner again. So I'm just asking you to do the right thing, not be selfish, and know that in doing the right thing, you'll be saving lives and jobs and businesses in Rhode Island. Having said that, if you insist on having a party, and if your party is greater than 15 people, then we will shut you down. Because the rules and these are not new rules, I'd like to take this opportunity to remind everybody of the existing rules, regulations in Rhode Island as it relates to COVID. Social gatherings of more than 15 people are not allowed. And if you do have a party, you can be fined $500 per person at your party, and individuals at your party can be fined. So, and the state police is tripling its enforcement presence around Halloween. We're in contact with mayors and local police. They're also going to be increasing their presence for enforcement around Halloween. And our DVR inspectors are going to be out in full force at bars and in restaurants. So I'll end where I began, which is asking you not to have a party. Because if you do, you're going to be facing a very steep fine, not to mention the fact that you'll be endangering the lives of Rhode Islanders and your loved ones and other people's loved ones. Parents, I need a hand from you to crack down on high school Halloween parties. So if your child was planning to invite a lot of friends over for Halloween, or you know your kids were going to go to a Halloween party, please help us out and don't let that happen. This isn't forever. This is for now, because we're in a bad spot and we have to bend the curve again. Next year there'll be Halloween parties. There'll be plenty of ways to celebrate, but I'm asking everyone to just pull together to do the right thing and just try a little harder. By the way, I know you're all trying. Everybody's already trying. Rhode Island's doing a great job. Our lives have been totally disrupted, and this is a tough ask for me to ask of you. But particularly as it relates to our young people, we are seeing cases skyrocket among young people, 19 to 24. So give us a hand if you can, please, to keep a lid on these parties. I know people are also starting to plan for Thanksgiving, so today I'm asking you to keep it local this year for Thanksgiving, and consider not traveling. In my family, as I said yesterday, we always go to Michigan to visit my husband's family. We look forward to it, but this year we're not going to go. Next week, I'm going to have a lot more detail around Thanksgiving, official rules, how we envision a safe Thanksgiving, but I know a lot of people are making plans now. There's no official prohibition, but I'm just asking you, please, to keep it local. We're in a precarious moment right now with our cases, and it would be great if you stayed local. We've talked all along about how our actions impact case numbers. What we do today will impact our case numbers in 2, 3, 4 weeks from now. So we're entering a tough few months right now, because 3 weeks after Halloween is Thanksgiving. A month after Thanksgiving is Christmas. And if we don't really start planning now for how we're going to have safe, small, local gatherings, then I worry that we're going to have bigger gatherings, and as a result, we may have to think about shutting down more globally in our economy, which is what I don't want to do. We had a stay-at-home order for Easter. We had a stay-at-home order for Mother's Day. We had a stay-at-home order for Ramadan and Passover and Father's Day. We don't want any more stay-at-home orders. We definitely don't want stay-at-home orders for Christmas and Hanukkah and New Year's. So let's pull together right now, stay local, stay small, keep our masks on so we can get to a better place. Okay, second thing I want to talk about, I'll be very brief because I know the doctor is going to talk about it, is mask wearing. I want to begin by saying you're doing a great job with mask wearing, particularly in retail shops, businesses, and restaurants. So I want to be clear, and restaurants in particular, you've done an amazing job, so thank you. Unfortunately, we have to do a better job of mask wearing in our small, casual, social settings. Going over to our friend's house, letting your kids go over to their friend's house. It's in these comfortable settings that we let our guard down. And we can't do that anymore. By the way, I'm talking to myself and my family too. We're all guilty of it. We've been at it for 7 months. This is a hard thing to do. And still, we have to do a little better. So I'm asking you to just have a renewed vigilance around your mask wearing. Just ask yourself, is there any reason why I wouldn't have my mask on right now? And the answer is probably no, in which case you should go ahead and put it on. You're at your friend's house for dinner, sit more than 6 feet apart. Sit outside. Wear your mask when you're not eating. If you're at a restaurant, put your mask on before your food comes. Keep your mask on while you're placing your order with your server. Later today, the Department of Health is going to be putting out new guidance around mask wearing, and Dr. Alexander Scott is going to talk about it in a minute. But suffice it to say, just a wake-up call for all of us, even when we're in casual settings with people we know and trust and love, be more vigilant about mask wearing. The virus doesn't discriminate, unfortunately. So there are people you know and trust and love, and they feel safe to you, but the virus doesn't discriminate, and they could be carriers. You could be a carrier and asymptomatic, so we really just need to be more careful everywhere wearing our masks. Another area where we've seen people get too comfortable is in break rooms and common areas in offices. It's the same pattern we see everywhere else. If people are in a structured environment, on a bus, at a school, on a manufacturing line, things are going pretty fine. It's when you're in a casual atmosphere, like a break room, that we all get a little bit relaxed and we're seeing a rise in spread in cases. And that's in an unstructured break room. People are chatting, they take their masks off, they're with their coworkers, so they assume it's safe. They get too close, too cozy, too relaxed, no mask wearing, and we're seeing problems. The other problem is in most places of work, break rooms are small, indoors, pretty confined, and have no windows. In a small break room, just a few people in there without a mask, there's a lot of spreading. And it's preventable. So effective today, we'll be announcing new regulations requiring the closure of break rooms for the next 90 days. We're also leading by example. I've asked Director Smiley to join us today. He's been working hard to close break rooms in state buildings and offices, but also ensuring employees have the time and opportunity that they need to take a break. By the way, that's important. I'm not saying don't take a break. I'm not saying don't have a coffee break, don't have a time to relax, don't have lunch. Of course you need to take a rest, take a break, have lunch, rest your eyes. Have a cup of coffee. But we have to, employers, I'm asking you to find alternative, safer ways than small break rooms in order for your employees to take a break and take a rest. Allow time for employees to do this, allow space for employees to do this, encourage employees to go outside, to take a walk outside. Set a table up outside, set a tent up outside, get another room that is much, much bigger, and you can keep the windows open. Require everyone to keep their mask on when they're in there. There are some employers I know that are governed by either contracts or federal regulations, and this may be difficult to comply. So in those instances, obviously we don't want you to break any of those rules. We have specific guidance available for you, and we want to help you. This is not meant to be punitive. We want to give you a hand in business so that you can close your existing break rooms, but also give your employees a safe place to take a break or have a meal. You can go to reopeningri.com, and that will have all the details and also some ideas. Some ideas, as I said, allowing folks to go outside, having a room with a refrigerator, letting people store the food in the refrigerator, but they can just go in with their mask on, get their lunch, eat it someplace else, having a sign-up system for a particular room. Just, we know we're seeing spread with 3, 4, 5, 6 people in a break room with no windows, no mask, so we have to stop that. And this regulation is in effect for the next 90 days. And again, all details later today will be at reopeningri.com. I do want to be clear, we're not talking about cafeterias. You know, many workplaces have a cafeteria or a big lunchroom. Obviously, schools have big cafeterias and lunchrooms. We're not seeing problems there. These tend to be big enough spaces, a little bit more structured, often have windows. People can sit a few feet apart. Windows can be open. So we're not talking about cafeterias or large lunchrooms. We're talking about smaller break rooms where people congregate. All right, employers. Here's the good news. This is how you know Rhode Island's a special place. I've been getting asked a lot, and even in the last 24 hours, by employers, hey, what can we do? By the way, they want to stay open. They know there's real consequences to going back up the curve. They can't afford to close their businesses, so they're asking, how can we help? So I want to thank you, thank you, thank you, thank you. And by the way, remind you that by and large, businesses are doing a great job, and we're not seeing huge spread. Except in manufacturers, we are seeing some issues, and we're addressing that one-on-one with manufacturers. So I want to talk about 3 quick areas that business owners can lead. First, if your employees can do their jobs from home just as well as they can in the office, go ahead and let folks stay at home working from home. I realize that's not true for every job. And as I said, by and large, we're not seeing big problems in workplaces. Having said that, there are many jobs that you really can do them just as well from home. So continue, please, for now, to let people work from home. Second, please make it as easy as you can for employees not to carpool. I know that's hard. That's a hard one. I'll just say this. We're seeing spread from carpools. That, by the way, is contributing, I think, to some of our problems in manufacturing operations. So if you have to carpool, obviously you have to and you need to do it. Wear your mask, even if it's your best friends that you carpool with, and keep the windows down. Wash your hands. If there's ways that you can change, if you're an employer and you can change the schedule to help folks cut down on carpooling, I'd ask you to think about it. I also ask employers to talk to their employees about the dangers of carpooling irresponsibly, and ask your employees to wear their mask and be careful and keep the windows down. And then third, I'd ask you please to encourage your employees to go ahead and get tested even if they're asymptomatic. And I'd ask you to put the slide up on the screen, please. The slide on the screen is a reminder of all the different groups that are the current areas of focus for our asymptomatic testing program. Anyone who falls into these categories that are before you, please go to portal.ri.gov and sign up for a test. The test is free. We're going to make it as quick, easy, and painless as possible for you, and it would be awesome if a lot of hairdressers, waiters, waitresses, barbers could get out in the next week and get tested, even if you feel great. We need to increase our testing of people without symptoms, but who are in these high-contact businesses. So my ask, if you own a restaurant or manage a restaurant, if you own a salon or manage a salon, if you own a spa or manage a spa, you know, a nail salon, etc., encourage your employees to go get tested. It's free. Give them the time in their schedule to go get tested, even if they feel great. We need to make a big push. We have a goal of running 4,000 tests next week on asymptomatic people. So if you're a service worker, any service worker, if you have a job, put you in contact with people, and I mean any, if you're a member of the clergy, work in a retail operation, please just go get tested. If you want to know, hey Gov, how can we help? Go get tested. Next week, portal.ri.gov. We want to test 4,000 asymptomatic people so we have a feel for how prevalent the virus is throughout our community. Okay, a few other asks. Teachers and principals, talk to the kids about how they shouldn't have Halloween parties and why they shouldn't have Halloween parties, the importance of wearing their masks when they're out hanging out with their friends, and help come up with some creative alternatives to these holiday parties. College and university leaders, crack down on the Halloween parties on campus, please. If you have a Greek system, please consider stay-at-home orders. Off-campus dwelling, please, you know who you are. We've already had enough problems with higher ed, partying, off-campus. Halloween's coming up. We have time to prepare. I'm asking you for your cooperation. And by the way, let us help you in any way that you think we can help. Faith leaders, I would say first, you're doing a good job. You're doing better than a good job. It's been great. I personally have been in a number of different places of worship over the summer. Great job. But we have to do a little better. It's not so much in the church. Again, in the church is structured. You've kept it short services. You keep the windows open. It's what happens after church. 3, 4, 5 people go to someone's house for a cup of coffee. Somebody goes out for breakfast. There's a coffee hour sponsored by the church. People you're comfortable with, you don't wear a mask, you get close together, you share food. Please, faith leaders, help us out over the next month. Ask your congregants to just cut that down, or if they have to be together, wear their masks. Bus drivers, please make sure everyone is wearing a mask when they get on the bus, when they're on the bus, when they get off the bus, and we're handing out masks to anyone on a bus who doesn't have one. Waiters and waitresses, go get tested, please. Wear your mask. By the way, all of you already are. Thank you. And stress the importance to your customers of wearing a mask. So I'm asking you today just to think about how you, all of you, in your personal and professional lives can make some changes, sometimes small, so that we can keep everybody safe. Finally, I was asked yesterday about my comments a week or two ago when I said I didn't imagine moving beyond phase 3 until there's a vaccine. And so I did want to clarify one thing, especially for our business community. While I can't imagine moving to a phase 4, which would be a wholesale reopening, including concerts and conventions and big gatherings, that doesn't mean all of our existing restrictions are going to remain in place as they are today for months. In fact, I really would like to begin to relax in certain ways. So for instance, a week or two ago I said we relaxed the table settings outdoors at restaurants. We said they could be closer together. We want to continue to do those things, a little bit larger weddings, a little bit more here, a little bit more there. Every dollar matters for businesses that are struggling, which is exactly why I'm asking you for your help right now. If we all recommit ourselves now to being as vigilant as we were a few months ago, then we will flatten the curve. Hospitalizations will go down, cases will go down, percent positive will go down, and we can get more people back to work. But unfortunately, if we don't, then we'll see the exponential rise, and that's just not a place we want to be. The reason I'm here today is because we have warning signs. We have great data, great testing, great contact tracing. We're seeing the flashing lights. Flashing yellow lights. So let's get on it. Let's change our behavior in every way that we can. You know, I was asked yesterday, are we going to send the cops when Mom is over? Of course we're not going to do that. We can't. I won't. And I have faith in you. I have faith and confidence in the people of Rhode Island. So as tired as we are, it's time to just buckle down a little bit, especially at home, especially when we're relaxed. Keep it more local. Cut down on your social interaction, wear your mask all the time, and I am totally confident that that'll get us to a better place. And then we can get on to the business of actually opening more businesses instead of throttling back, which would be a very bad place to get.